Welcome back to the New York State Department of Health Clinical Education Initiative's Building Blocks for Trans and Gender Diverse Care series. My name is Erica Bostic, my pronouns are she and her, and I'm an adolescent medicine physician and faculty for the CEI Sexual Health Center of Excellence. In this video, we are going to apply what we have learned in our series thus far to a telemedicine visit. I'm about to meet a new patient via telemedicine. Here's what I know about him so far.
I'm about to meet my new doctor. Pretty anxious about it. The form they had me fill out online ahead of time asked me for my affirmed name and pronouns, which is definitely the first time that's ever happened, so that's cool. I'm really hoping that she's gonna be okay with prescribing me some testosterone. This is the only doctor I was able to find who had a good recommendation online, and I feel like this is my only shot. Here goes nothing.
Hi Taylor, I'm Dr. Bostic. It's nice to meet you. What brings you in today?
Well, I'm really looking for someone who knows how to take care of someone like me. I had that at college, but it's been a little hard to find now that I'm in the real world, you know?
Yeah, all right, I got that. Well, I feel confident that I can be that for you. Let me get some more information so we can get to know each other a bit better. Sounds like you're here to establish care. What else is going on right now? Any aches or pains or worries?
I guess not really. Overall, I've been pretty healthy. I'm smoking, and that's honestly getting pretty expensive, so I've thought about stopping. But other than that, I'm really just looking to pick up where I left off with my college doctor. You know, I'm really afraid that I'm going to lose all the gains that I've made.
Absolutely. I definitely want to hear more about your smoking habits and how I can help you make a change. Would it be okay if I got a bit more background information, particularly about your medical history and exactly where you left off with your college doc?
Sure.
Great. So, any medical conditions that you have, such as asthma, high blood pressure, what about surgeries that you've had?
Well, I've been lucky. I really haven't had any medical problems. I don't know about high blood pressure because I haven't checked or anything, but I don't know, no one's ever mentioned it in the past. I did have surgery on my chest just a couple of years ago. I don't know how much I should say. I really don't want to scare her off. I just want to have a normal prescription for testosterone again.
Okay, so sounds like you're pretty healthy. Let's keep it that way. So for your chest surgery, do you mean top surgery? If so, any issues with healing or recovery? Are you happy with the results?
Yeah, top surgery. I didn't know if you would know what that meant. Yeah, I'm really happy. It's like the best thing that I've ever done.
Great. Have you ever had any other surgeries related to your transition or anything else?
No. Some of my friends have gotten a, whatever it's called, the when they got their uteruses out. I don't know if I want to do that, but, I can definitely see the advantages.
I didn't necessarily bring it up formally, but in my head, my organ inventory looks like, okay, breast tissue removed, though that doesn't eliminate the need for future cancer prevention strategies, but certainly reduces the chances. Still has a uterus, cervix, and ovaries. I need to pay attention to this in the future to make sure that I check in about pap smears and menstrual suppression and contraception needs that he may have. Got it. Well, you let me know if anything changes for you. I'm not the type of doctor who performs those surgeries, but I can talk with you about the pros and cons and refer you to a surgeon if you want to learn more. What about medications? I see that you take an antacid every once in a while, but that is all I see on this form. Are you taking any other medicines to help with your transition?
Well, here it is, the moment we've been waiting for. Well, I started T in college with that doctor I mentioned, but since then I had to leave, and now I'm on my own. I haven't had a doctor that I could go to, so I haven't been prescribed testosterone in a couple of months now.
It seems like leaving college really interrupted your transition. Did you stop taking testosterone?
Well, not exactly. I still had some vials left over that weren't totally out. And some of my friends gave me some extra tea that they had. I also found out, honestly, if I go to a pharmacy and I ask for syringes, I can get up to 10 at a time. I try to keep them really clean because I know that that's important. But I haven't had a steady supply in a while, so I get what I can get. But it's been really up and down.
Well, I can help with that. I imagine both physically and psychologically it's been concerning to not have reliable access to a critical medicine. It sounds like you were able to keep up with a medication that you know is important, and you found a way to get clean syringes to keep safe and healthy. It definitely would be better to have a medical provider prescribe it, not just so you have access to it, but so we know you are taking the correct amount and you have enough clean supplies to safely administer it.
Honestly, it's so good to hear you say that. I'm actually a really straight edge guy normally, so I want to make sure that I'm taking the right medicine from a doctor. But if I had to choose between not getting my tea at all or taking it the way I have, I'm gonna take it however I can get it. I was actually studying to be a nurse when I was in college, so I really do get how important it is to be safe with meds and needles and all of that stuff.
I'm glad we're on the same page. Let me ask you a few questions about your family history. Just do the best you can. I understand you may not know everything about every member of your family, but any history of blood clots, heart disease, or cancer? What about someone dying suddenly for an unknown reason?
Honestly, I'm not really close with my family. They haven't been particularly supportive of me transitioning. So when I went to college, I kind of just left that part of my life behind. I remember that when I was young, I went to the hospital to visit my grandmother who had a stroke. She later died in the hospital from that, but honestly, that's all I can remember and all I know.
I'm really sorry to hear that. Part of what I do in addition to just providing the medicine is also providing resources and support for families. I realize that a lot of weight may come with that, but just so you know, in case in the future you think that might be helpful for you. Switching gears a little bit, I'd like to ask you some more personal questions. Not because I'm nosy, but because I want to be sure that I'm addressing all aspects of your health. Would that be okay?
Sure, yeah, I get it.
Thanks. So let's start with where you're living right now. Since you are no longer at college, are you doing any classes at all or working?
Well, I've been staying with a friend who's been really cool to let me move in before I could even really pay my fair share. I'm a hustler. I don't want to fall behind, so I've been doing food delivery and really, whatever I can, odd jobs here and there to pay some rent. I'd like to get back to my nursing degree in the future. There's a community college right near where we live, but honestly, that feels like a little further down the line at this point.
You mentioned before that you are smoking. Is that tobacco, nicotine, weed, all the above?
I'm just smoking cigarettes. I found that they really helped when I was anxious, going to parties at college. Now it's just hard to quit. It's cliche, but it's true. But I don't touch anything else, no other drugs, nothing like that.
Thanks for sharing that. Since you expressed earlier in our visit wanting to quit smoking, I have some ideas that we can talk about maybe at the end of our visit. You mentioned living with a friend. Do you have any safety concerns where you live or work? Any bullying or harassment?
I live with a friend, Aiden, who's trans like me. He's great, so I feel really safe at home. We do live in a more rural area, much more rural than where I grew up and what I'm used to. So sometimes when I'm out doing deliveries, I get worried that people who answer the door might notice something about me and bring something up. But I pass pretty well, I think, so it hasn't been too much of an issue.
Got it. I also check in about safety within oneself for all of my patients. Not something I ever want to miss. In your lifetime, have you ever had thoughts of hurting yourself, like suicidal thoughts or self-harming, like cutting or burning?
I mean, when I was living with my parents, I was pretty down. There were some times where I thought that, things might just be easier if I got in a car crash or something like that. But since I've been living with Aiden, especially since I got top surgery and just getting away from my family, I haven't had a single thought like that. I'm, happy to be alive.
Okay. Well, thanks for sharing all that. I know it's very personal. I have a few more personal things involving sex and the role it may or may not play in your life. Have you ever had any type of sexual contact with another person?
I had a girlfriend, Alyssa, in college. We kind of broke up, but we still talk. I haven't been with anyone physically since then, and honestly, I'm pretty okay with that right now. There's just like so many other things that I want to work on and take care of that I think a relationship at this point would be a bit much. Plus, I don't even know where I would meet anyone out here. Like, it's really rural.
Right. So it sounds like your relationship with Alyssa was pretty important, but you aren't having sex with anyone else right now. If anything changes there, feel free to let me know. You mentioned earlier that you may consider having a hysterectomy in the future, but while you still have those parts, we want to be sure that we keep them safe and healthy. That may include talking about contraception. Some of my patients can find sex a bit difficult as their bodies change through transition. So if you ever want to talk about that more, I'm here.
Yeah, honestly, I've never had a doctor offer that or say anything like that before, so that sounds great.
So lastly, I offer all my patients screenings for STIs. Would that be something I could help you with today?
Alyssa and I were part of a sexual health club on campus, so we got tested regularly, just like sort of as part of our advocacy work. I also taught some of the other students about PrEP and stuff, so I'm all up to date, and since I'm not seeing anyone right now, I think I'm good, but thanks for asking.
For a non-telemedicine encounter, I would explain what to expect with a physical exam. For telemedicine, we'll skip over this part. Okay, Taylor, well, it's been really great getting to know you. Let's review. Your main goal for today was to establish care with a doctor. Check. It's really important for you to have a prescription for testosterone, which I am happy to provide. We will need to go quickly over a consent form, reviewing the risks, benefits, expectations, all information that you've heard before. Do some blood work, and then I can send a prescription to the pharmacy that you listed on your form. You are thinking about quitting cigarettes. I'd love to explore that more with you at our next visit. Does this sound like an okay plan for you?
That sounds awesome. Like, it just sounds great. Like, as soon as you put in that order, I'm gonna go to lab right away and get it done today.
The next steps would be reviewing the consent form, ordering and analyzing the appropriate lab tests, and prescribing the medication, all of which we'll discuss in our next videos. Tune in.